Hello everyone. Our topic for today is nail and foot care. Incorporate foot and nail care into a person's regular hygiene routine. Routine care involves soaking the hands and feet to soften cuticles and layers of horny cells, thorough cleaning, drying, and proper nail trimming. The one exception is patients with diabetes mellitus or peripheral vascular disease who are at risk for tissue ulceration or infection because soaking causes skin softening or maceration of tissue. Take time during the procedure to teach the patient and family proper techniques for cleaning and nail trimming. Stress the importance of how thorough nail care prevents infection and promotes good circulation. Patients must learn to protect the feet from injury, never walk barefoot, keep feet clean and dry, and wear footwear that fits properly. Instruct the patient in the proper way to inspect all surfaces of the feet and hands for redness, lesions, dryness, or signs of infection. Teach foot care to family caregivers for patients who need regular foot care and have peripheral vascular disease, visual difficulties, physical constraints, preventing movement, or cognitive problems. Purposes: to maintain the skin integrity, to prevent foot infections, prevent foot odors, and to monitor foot problems. For the special considerations: assess the client for the following: condition of skin surfaces, presence of edema or tenderness, circulatory status, usual foot practices, and self-care abilities. Another consideration is to avoid soaking the hands and the feet of diabetic clients since it increases risk of infection in such persons. Another consideration is to obtain physician's orders for cutting nails if agency policy requires it. Client skin may be accidentally cut and the clients or certain clients are more at risk for. For this procedure, we will be needing the following materials: a wash basin containing warm water, moisture-resistant pad, emery board or nail file, disposable bath mat, and a disposable gloves. We will also be needing disposable pad, washcloth, emesis basin, nail clippers, orange stick, and also pillow, towels, soap, bath lotion, and paper towels. For the procedure: explain the procedure to the client, including the fact that proper soaking requires several minutes. Client must be willing to place fingers and feet in basins for 10 to 20 minutes because client may become anxious and fatigued. Wash hands and arrange the equipment on overbed table. This will give easy access to equipment which will prevent delays. We assist ambulatory client to sit in bedside chair. Sitting in chair facilitates immersing feet in basin. A bath mat is also placed to protect feet from exposure to debris or soil. We also help bed-bound client to supine position with head of bed elevated. Place the disposable bath mat on floor under the client's feet or place the towel on the mattress. We place the basin on a moisture-resistant pad at the foot of the bed for a bed client or on the floor in front of the chair for an ambulatory client. For a bed client, pad the rim of the wash basin with a towel. The towel will prevent undue pressure on the skin. The temperature of the warm water inside the wash basin should be about 40 to 40 degrees Celsius or 105 to 110 degrees Fahrenheit. The warm water will soften the nails and thicken epidermal cells, thus reducing the inflammation of the skin and promote local circulation. Proper water temperature will also prevent burns. We place the basin on bath mat or towel and help client face feet in basin. Place the call light within client's reach. Clients with muscular weakness or tremors may have difficulty positioning feet. The client's safety should always be maintained. Instruct client to place fingers in a message basin and place arms in comfortable position. Prolonged positioning can cause discomfort unless anatomical alignment is maintained. Omit soaking in patients with any of the following conditions: diabetes mellitus, peripheral neuropathy, and peripheral vascular disease. We allow the client's feet and fingernails to soak for 10 to 20 minutes. Rewarm after 10 minutes. Softening of corns, calluses, and cuticles ensures easy removal of dead cells and easy manipulation of cuticles. Clean gently enter fingernails with orange stick while fingers are immersed. Remove emesis basin and dry fingers thoroughly. Orange stick removes debris under nails that harbor microorganisms. Thorough drying impedes fungal growth and prevents maceration of tissues. Shape nails and emery board or file. If client has circulatory problems, do not cut nails. File the nail only. Push cuticle back gently with orange stick. This reduces the incidence of inflamed cuticles. While wearing disposable gloves, scrub calloused areas of feet with washcloth. The gloves prevent transmission of fungal infection, and also the friction removes dead skin layers. Gently clean under nails with orange stick and remove feet from basin and dry thoroughly. Removal of debris and excess moisture reduces chances of infection. Clean and trim toenails. Do not file corners of toenails. Shaping corners of toenails may damage tissues. Lotion to feet and hands. The lotion lubricates dry skin by helping retain the moisture. If the client would want to go back to bed, we assist and placed her in a comfortable position. Otherwise, we remove our materials on the overboard table. Remove disposable gloves and place in receptacle. Clean and return equipment and supplies to proper place. Dispose of the soiled linen in hamper. Wash hands. This will reduce the transmission of infection. Inspect nails and surrounding skin surfaces after soaking and nail trimming. Make sure that the patient is comfortable before we leave his or her room. Record procedure and observations, like breaks in the skin, inflammation, ulcerations. This will allow the nurse to note any remaining rough nail edges. We also have to document the procedure, the client's response, and the presence of the abnormalities requiring additional therapy. Report any breaks in skin or ulcerations, which can seriously increase client's risk of infection and must be carefully observed. Modifications. Prior to soaking the feet, the nurse may cleanse feet with soap and water, paying particular attention to the interdigital areas, and may soak one foot at a time. For the health teaching, we instruct the client to wash feet daily and dry them well, especially the toes. When washing, inspect skin of the feet for breaks, or red, or swollen areas. Use mirror if needed to visualize all areas. To prevent burns, check the temperature of the water before immersing the feet. Cover feet, except the toes, with creams or lotions to moisten the skin. To prevent or control unpleasant odor due to excessive perspiration, wash feet frequently and change socks and shoes at least daily, and avoid socks with holes or darns that can cause pressure areas. Wear comfortable, well-fitting shoes that neither restrict the foot nor rub on any area. Rubbing can cause corns and calluses. Avoid walking barefoot. Wear slippers in public showers and change areas to avoid contracting athlete's foot. Avoid wearing constricting garments such as knee-high elastic stockings, and avoid sitting with legs crossed at the knees, which may decrease circulation.